Welcome, everyone. My name is Haley Buckner, and I'm the Professional Relations Manager for Elevate Oral Care. Thank you so much for joining us this evening. Before we get started, I'd like to take a moment to cover a few quick housekeeping items. For those of you who remain online for at least 50 minutes, your CE certificate will be emailed to you within hours of this presentation. Please be sure to check your spam folder just in case it ends up there. Everyone is currently muted, so there's no need to worry about background noise during the session. We will have time for Q&A at the end of the presentation, and you can submit your questions via the webinar dashboard as we'll be tracking them throughout the talk. We've hosted an extensive series of free live CE webinars on a variety of prevention topics. These webinars are recorded and available for free self-instruction CE at the website you see on the screen, elevateoralcare.com/elevatingcare. Be sure to bookmark this page and check back often for new CE opportunities. If there's a specific topic you'd like for us to cover in future webinars, feel free to send your suggestions to info@elevateoralcare.com or complete the webinar survey that will be sent to you after this evening's session. We love receiving your ideas and often design webinars based on your feedback. Tonight, we are thrilled to be joined by Dr. Michael Bratland. Dr. Bratland's career is rooted in service and family, a path established by earning a degree in journalism and marrying his college sweetheart. He made a defining career pivot, moving from marketing to dentistry to pursue a life of greater impact. He graduated from Tufts School of Dental Medicine in 2005 and founded Chris Dental, named in tribute to his late older brother, Chris. Dr. Bratland built his legacy in accessible healthcare, specializing in serving Medicaid patients since 2005. His commitment led Chris Dental to become a model for public health dentistry in the state. He uniquely mastered both the complex business of public assistance and the crucial role of a dedicated healthcare provider. This expertise is highlighted by his commitment to clinical efficiency through the extensive use of silver diamine fluoride. This cost-effective, non-invasive method is a standard of care across all his organ offices and used on almost all patients, ensuring the highest level of decay treatment. Today, Dr. Bratland remains active at his Chris Dental Eugene location, driven by the same personal commitment. He lives in Eugene with his wife, his large family, which includes 7 children, grounding his mission of service directly in his family life. Dr. Bratland, thank you so much for being here this evening, and I'm going to turn it over to you.
Well, thank you, Haley. So I'm going to talk today about SDF and how it's transformed my dental practice. My title of my presentation is Stop Doing Fillings. Not exactly. You're still going to have to do some fillings, but with SDF, it makes your life a lot easier. If you look down, you'll see my actual cell number. I don't mind giving my cell number out to thousands of people. I have given my cell number out to all my patients the last 20 years. And luckily, for some odd reason, I don't get hounded by patients very often. But I do want, if a patient does have a dental emergency, I always want them to get a hold of me. Now, given at 2 o'clock in the morning, I'm not going to pick up my phone, and I tell patients that. But feel free to text me or call me if you have any questions. I love SDF, and I've been using SDF or silver nitrate. I've been using silver nitrate since it came out, like years ago. I can't even tell you how many years it's been. I hate doing fillings. I'm really good at fillings, but I think if you're any dentist, after a while, after dental school, you get really tired of doing fillings. My son is in dental school, and he loves doing fillings. I'm like, just wait. like after you've done so many MODs and you do a big filling and you don't have great contact, and you have to redo it, you start to hate them. So SDF, when I heard about SDF, and it was first silver nitrate, where we had to put the silver nitrate on first, and then we'd cover it with fluoride. When I heard about it, and all I heard was, hey, it reduces, it stops small cavities. I was like, this is great, because I don't like I say again, I don't like doing fillings, and if I can save the patient time and pain and suffering by using medicine and not have to pick up a drill, I'm going to do it. And so I've been doing silver nitrate, and then when it turned into SDF, I've been using that. I use it everywhere. To tell you a little bit about myself, I've probably had about 20 offices in the last 20 years. I currently have 7 or 8 offices throughout the state of Oregon. I say 7 or 8 because I'm always open in a new office, and we have ones from Southern Oregon all the way to Portland. And my office in Eugene that I work in, the Chris Dental in Eugene, is 100% private pay. I don't do any Medicaid contracts, but my other offices we do. We predominantly Oregon Healthcare. And when I talk about SDF, a lot of people think it is just for my Medicaid patients. It's not. And I do SDF on probably 99% of all my patients in Eugene in a private pay practice. And I have people that are very cosmetically concerned, and then I have people that don't really care, but I do it on everybody. And I'll kind of go into that a little bit later about how I talk to patients about it. But SDF is a game changer for any practice. And so let me get started here on my slides. This is a paraphrase quote because it was a big quote. Oh, and for some reason I lost where it came from. But it was a study showing that composite fillings were actually promoted future cavities. And I've always kind of felt like that. You put a composite filling in, and it is as best, strongest it will ever be right when they leave the appointment. And then as time goes by, without just impeccable oral hygiene, flossing and brushing, you're going to get cavities around those fillings. So I'm not a big fan. And now again, I do composites. My practice, just to let you know about my practice, and I think it'll kind of describe. Oh, there it is, Journal of Dental Research. Last couple of years, last year I did my revenue for SDF was a little over $172,000. I think the year before was $146,000. That is just in my Chris Dental Eugene office, not all my Medicaid offices. And I'll tell you how I get to that 172,000. But again, I'm gonna tell you, I bring up the numbers not because like to brag, but I give it numbers that what you can do with SDF. And SDF is not a practice killer. It actually grows my practice. My office in Eugene, all I do, I have 4 chairs. I have 2 hygienists, and up until last year, it was only me. And I'm gonna give you some numbers. And again, it's not to brag because at this point, it's not about the money. It's about I've been doing this 20 years. It's about just doing what's right and having a practice that I really enjoy going to work and surrounding myself with wonderful people. And so last year I did 2.6 million, a little bit over 2.6 million in revenue. And year before that, I was like 2.5, and it was 2.5 by myself. And then I realized if I could bring in another doctor to help do the crown seats and do some of the fillings and do some of the exams, then I'd have more time because I have a lot of practices. I do real estate and I do a lot of things. And so in between patients, I just do crown preps now, and I go back to my computer and I work on my business. But with the SDF, we don't have to do a lot of fillings. What we do in my practice, all we do is besides perio is we do SDF, and we do not many fillings, and I'll kind of go over the numbers there. And the last couple of years, I've done over 1,000 crowns per year. All I do in my column is crowns. And what's wonderful about SDF, and people are like, oh, well, you're just promoting crowns. And no, we can see a huge amount of patients, a lot more patients than we ever did before, because we stop their disease. Patients come to us all the time, and they're frustrated. And you get a lot of patients like this that will have spent thousands of dollars over the years, and every year they come to dentist and they get this anxiety because they go into the office and there's cavities. It's always a cavity underneath the crown. There's always a new cavity. And I sit them down, and one technique I love to do is when I come in and I sit down in the chair and I look at them one-on-one, and they're frustrated, and I can tell. I said, you're probably really frustrated and you get anxiety. You come to the office and you're like, oh, here's another crown, another filling. And I tell them, I said, with the medicine that we use, we have a special medicine that's a game changer. And I really believe this. That we will get to the point where you won't get new cavities. And they just like, they look at me kind of at first, kind of like I'm selling snake oil. But after a while, they understand how important SDF is. It is a game changer. And what it allows me to do is I see a lot more patients than normally a lot of patients would, because I can see them. They don't, and this is a side effect too. The SDF is their caries so much better, and I'll get into that. So yes, I have probably 4,000 or 5,000 active patients, and I do have the patients that only want to be seen once a year, and I have those patients that only want to see every couple of years. They break a tooth or something like that. They want to see me, but it allows me to see a lot more patients without just a constant new cavities, doing a ton of filling. And I don't do, at this point in the game, I don't do dentures, I don't do partials, I don't do root canals. I'll do an extraction if I'm doing a bridge, but I don't do anything that I don't want to do anymore. And the revenue is great. My overhead's about 53%. I think last month it was, a couple months I got under 50%. And it's because I just focus on SDF and crowns. And when patients get to the point where they don't have any more cavities, they love me. And I'd actually rather have 4 chairs full of hygiene. Probably wouldn't make as much money, but I'd rather just come in and say hi to them and not have to do a lot of treatment. So I'll move on to the next slide. And I put on here happy patients. Patients love it. This is the little chart, shows in the last couple of years how I've decreased the number of fillings a lot, and I've increased my crowns over the years. And the reason why it shifted a lot, about 2023, I got to the point where I was done with dentistry. I hated dentistry, hated doing fillings, hated doing everything. And I thought, you know what, I'm just gonna stop doing anything I hate to do. And it was probably the best thing I've ever done. So if anybody wants to call me and talk to me about how to really focus on a practice, one of the things I hear from consultants all the time, and I go to these big seminars, is like, don't refer anything out. And I gotta tell you, I refer everything out. And it just makes my life easier. I don't do implants. I don't do anything except for crowns. And life has never been so easy, and I really enjoy. And it's really crazy when I stopped doing everything, even though I was really good at crown preps, I became a lot better. I've done crown preps now, and they look beautiful. And I look at the clock, and it's like 3.5 minutes. Like, holy cow! Not everybody's 3.5 minutes. Don't get me wrong. Like if I get to 10 minutes, like I'm spending too much time on this crown prep. But the more when you focus on just one thing, you get so much better. And so that's my word of advice: is don't buy into that you have to do everything. So I'm going to kind of go over today. I'm going to go over the billing, how we build the SDF, and how we communicate with patients. Communication is key, because you're going to get a lot of people at the beginning going, no, I don't want it. So my script is, and I won't, I'm not going to read every slide that you see. You can do that. But, I usually sit there, and I have a lot of passion about SDF. So I sit down, and I'm like, hey, I'd like to place some medicine on your teeth. I always say it's a game changer. It's the best thing we do. Sometimes I'll give an analogy is like, hey, your mouth is on fire, and you've been going to dentist for a long time, and they never put out the fire. It's kind of like your house is on fire, and you keep on calling a contractor to remodel the kitchen. And so I take a step back, and if there's cavities everywhere, I don't waste my time treatment planning and everything. I step back and go, okay, obviously we're going to address any of the abscesses, anything that's really jumps out that we have to take care of, and the broken teeth, or the tooth that is the decay is so close to the nerve that we got to do a crown tomorrow, or as of yesterday. Otherwise, they're going to need a root canal. But everything else, I don't waste my time sitting there going through everything. I want to put out the disease, and so we talk about oral hygiene, we talk about nutrition, but we have to start the SDF that day. And sometimes people are like, I don't want to do the SDF. That's a stuff to stain, but we'll talk about that. I get maybe once in a while, I get somebody who says no. They usually say no. And keep in mind, if you read or watch podcasts on sales and dentistry sales, we have to convince people that they need to pay for something, that they'd rather go on a trip or pay for an iPhone or buy a new car. And I really believe that oral hygiene is the most important thing in somebody's body. There's so many links to bacteria in that person's mouth, to pancreatic cancer. Now they find these spiral bacteria in the brain. that is in 99% of people with Alzheimer's and dementia. And so I emphasize that patients like, listen, you might not think this is important, but this is so important. And SDF as part of it is huge. It is, and I'm going to talk to you about SDF underneath temporary crowns and how it affects gums, but it's wonderful. So I have a lot of passion. So I don't get people hardly ever to say no to the SDF. So I sit them down, and you can word it any way you want, but you have to have passion. You have to understand that SDF, I want to say this to everybody, SDF is for every single person that has previous restorations, that has active caries, somebody that's geriatric, that is dry mouth. If they start having dry mouth, we've seen it, dry mouth, they can go from no cavities to cavities on every tooth within a year. And it's kind of like the kids that go into the military and they start drinking Mountain Dew, and within 6 months they have cavities everywhere. So SDF, I use it 99% of patients. Now there is the occasional patient that comes in that has never had a cavity. Their biofilm's perfect, everything's beautiful. We will watch, we'll keep an eye on, but there is a few exceptions to the rule where I won't place the SDF. And I won't place the SDF on the patient that comes and they're all Botoxed up and their lips are filled and they have all veneers, and I won't touch them. I won't do that. But luckily in Eugene, Oregon, we don't get a lot of those patients. But I steer clear from patients that I worry that one little spot, they'll get upset. Staining. So this right here, I took this recently. This was actually staining not because of decay or demineralization on the tooth. This was a great tool to show my hygienist that she missed a lot of the plaque on the tooth, which won't happen again. But we're easily able to remove that quickly. And the patient was panicking, sent me that picture in a text, and I said, listen, don't worry about it. First of all, I love staining, and I'll talk about that in a second. I love to see the staining. We will not place the SDF on the front teeth. If you look on this, you can actually see where I have SDF on the distal of the canine. Oop, let's go back. Probably, I don't know how to go back. So let's pretend you can see that. But I put it on the distal of the canine further back. I will take the patients that have, some patients will come and they have decay everywhere. The decay is black. I will put SDF everywhere then when their decay is already black. And I say, listen, it's going to look bad, but we're going to get the disease under control. And it might make your cavities even darker, but we've seen it. When a person comes in, and it's like a meth mouth, but it might not be meth. But I will put it painted everywhere. And sometimes geriatric patients, if somebody comes in and there's stains or black, it doesn't matter, I'll put it everywhere. But for that patient, we put it on the back of the teeth, and the patient was panicking, and I'm like, listen, don't panic, we're gonna get it off. It's either plaque, I always tell patients, SDF will stain, and I love the stain. If you change it to you love the stain, they think about it differently. I'm like, I love the stain. Now, given if it's a concern, because it will only stain plaque, calculus, or decay. And I re-emphasize that, plaque, calculus, decay. So if you see stain, if you go and you pull back your cheek and you see a little bit of stain, then it's plaque, calculus, or decay, nothing else. If you put on a healthy tooth structure, SDF will not stain the healthy tooth structure at all. And you got to emphasize that. I've had some patients come back, oh, that tooth looks darker. I'm like, no, you don't understand. It looks like, I tell patients all the time, it looks like you're a heavy smoker or you drink a lot of coffee, but it only stains. It's an astringent stain that we can take off with if it's plaque or calculus. And if it's demineralization or decay, we can't, but it's wonderful. It's awesome. So I'm going to go into fees, and I'll talk more about the SDF, a little bit more about application. So what we do in our office, if somebody has insurance that covers it, and if you look at the $175,000 I brought in SDF last year, a lot of it was insurance, but we're really conscientious of our patients and how much money the insurance will pay. Insurances will pay anywhere from $200, and I've heard recently one insurance company paid like $500 for SDF. That's great if the patient doesn't have a crown or other treatment that needs to be done that year. Because what happens is if you bill them out $300, $400, $500 on insurance, and then all of a sudden they have a crown, then they get kind of upset that they paid $400 or $500. You can do whatever you want. And some patients, some offices would like, no, we're going to charge out the SDF, because given if we do the SDF and they never come back for the crown, then you lost out on money. But I'm very conscientious of patients' expenses. And so if I do a new patient exam and they have a bunch of treatment and we know we have to get to crown number 19 tomorrow, what I'll say, listen, we can bill out your insurance, but your insurance pays a lot of money for SDF, anywhere from $20 to $75 per tooth. But I'd rather just do a cash paying fee of $145 a year, or $148 for the whole entire year. And with our plan for $148, every time they come in, we put SDF on. Now, I won't put SDF on sometimes after a quadrant scaling if it's bloody. I won't put SDF on if we do an extraction for a bridge. But I was informed a long time ago, and I could be wrong. Do your research. But I was told you could do it up to like 8 times a year, and it wasn't an issue. Yeah, it wasn't toxic. So I place it on every time they come in. And just the more repeated times, and patients will ask you sometimes, like, why do I need it more than once a year, or why do I have to do it every year? Well, because your teeth are constantly bombarded by acids. The bacteria constantly breaks down the tooth. So I like to place it on just constantly forever. And it is the cheapest thing patients can do to prevent future expenses in dentistry. It is a wonderful product. So for $148, I'm not making a lot of money off of it. And I also give them the prescription toothpaste, and I have a slide on that a little bit later. But I do I give them a toothpaste, and I tell them on the toothpaste, use it once a night. Again, I'll go over that again a little bit later. But $148, and I place it every time. If they don't have anything going on in their mouth, then we bill out the insurance, and we do it. We bill out the insurance once a year, and it pays really a lot of money, and it's wonderful. And I, from a standpoint from insurance company, I think it's wonderful because they are paying a lot of money for it, but they are getting the benefit of less dentistry in the future, and probably a lot less health issues if the dental insurance is connected to a medical. So fluoride, I misspelled the word, I'm sorry, but don't bill out fluoride if you bill out SDF to insurance. So if we do SDF in the back, we don't also bill out the fluoride, because I've been informed, and I was informed this morning, that if you bill out fluoride along with the SDF, they won't pay for the SDF. They'll just pay for the fluoride, which conveniently for them is a lot less money. So just bill out the SDF. And we do for Medicaid does, because a lot of my offices are Medicaid, we are able to bill out SDF and fluoride. And I believe and don't quote me on this, but I think we can also do irrigation with iodine. Again, down the bottom, I just say this, and don't bill out insurance. Just be conscientious about not billing out the insurance. I wouldn't do it if they have a lot of dental treatment. Now, if it's the end of the year, it's December, November, and you're probably not going to get back to January, just bill out the insurance. Get the money. I love this little Lingua Fix saliva. I buy it from Henry Schein or Patterson. It is wonderful. I think it cost me about $1 a piece. I use it all the time. I use this thing. I use it for crown prep sometimes if the tongue's fighting me. It's a disposable. I hardly ever, you see it's attached to saliva. Unless the person is like literally just tons of saliva, I won't actually hook it up to the suction. I just put it in there and I use it. I will dry out the teeth. Now, for those dentists that say that SDF doesn't work, I gotta tell you, you're doing it wrong. That tooth has to be dry. Not just a little dry, but really dry. So if you see up here, they're turned to the side. What I do is I turn the person to the side, or I don't do the SDF 99% of the time, my assistants do, or the hygienist does. Turns the head, so the saliva rolls to the side, and when I'm blowing the air, I start from the anterior backwards, so I push the saliva down and back out, but you really have to dry out the teeth. I also don't floss. Some people have a technique where they floss the SDF in. I don't do that. And I have fantastic results. And I was going to, and I forgot, but I was going to put a picture of interproximal caries. I want to mention this. If you do it a lot, you do it properly. It's not just incipient caries you can stop. You can stop full-blown, really deep decay. Now, how deep? Like everybody's a little different. Depends on the nutrition, their flossing, but and I obviously the deep cavities I'm going to do a crown, a lot of times a crown on. But you'll be surprised how effective SDF is. I had this patient one time. It was just unbelievable. I had placed a lot of SDF on his teeth everywhere, and we did this for like a year. And he probably came in probably 5-6 times that year. And then I said, let's just stabilize it. Let's get your house. Let's stop the fire in your house, and then we can go back and we start remodeling the kitchen. And after a year, he came because he didn't like how dark his buccal calcifies were on the canines. And I placed so much SDF on it. And so I started to drill out the SDF, and it wasn't like a millimeter deep, it was like 4 millimeters. It was so crazy deep. It was like removing a silver filling. And had he not wanted it from a cosmetic standpoint, I wouldn't have done it. I removed all the staining, and then I put a glossonoma in there. But really, honestly, for his health and his gums, it would have been better just to keep the SDF there. Now, I understand why he didn't want that, but it is wonderful if you do it right. And again, I'm going to reemphasize, dry the teeth off. And if you have assistant hygienist doing it, one way to tell they didn't do it right is that the patient comes back and you look in their mouth and you see all this decalcification and there's no staining. And you're like, okay, the hygienist did not do it right. It's super easy. It works great. Just place it, just, for most patients, put from canine back. And what I do is I place it on it, and I'll wait. I'll go on the bottom, and it doesn't take that long. The whole treatment takes about 5 minutes at the most. If you have assistants hygienists doing like 20 minutes, they're doing it wrong. I dry out the tooth really quick, but I make sure it's dry. I paint it on. I dry off the top. I keep this the saliva ejector in there, and I work on the top, dry those off, place it on, and then move to the other side. And you're supposed to leave it for about 60 seconds, but by the time I do, I think it's close enough. But the way I do it is very effective. They come back, and I see the staining. And again, I love the staining. This is my little trick, and there's unidoses from Elevate Oral Care, but you can also do this. I keep the tips off of the needles. The bottom of we always have a baggie where we keep these tips. Then what I do is I take the needle holder, those heavy little metal holders. I put a baggie. I put this little the bottom of the needle cap in there, and I put a couple drops. Now, if it's just one tooth, if I'm going to do SDF around one tooth or underneath a temporary crown, I'm just going to do one drop. If I'm doing the whole mouth, I do 2 drops. Now, I just mentioned the temporary crowns. If you do not place SDF underneath your crown preps, especially the ones that are subgingival, it's a game changer. It is the best thing I do. Since I do so many crowns, when we take off that temporary crown, I take off the temporary crown, and without the SDF, when I take off the temporary crown, the gums look like a hamburger. They bleed. I use just crowns. I don't know if you guys mill your own crowns, but if you, I'm gonna give a little plug for a lab at Just Crowns here out of Boise. They're wonderful. And what's really cool about this lab is they can get your lab. I can scan, and I can get my crown back the next day. Usually I book them. If I do a crown prep on Monday, I do a crown seat next week. Then they can send it in the mail, and it usually gets 3-4 days. But underneath the temporary, I put the SDF. I put the SDF anywhere subgingival. Now, if the person has a crack in the tooth, I put the SDF. Wonderful about SDF is if there's certain areas a little bit, not on the margin, but if there's still a little decay. And wonderful thing about SDF is you don't have to remove all the decay. As long as it's not on the margin of the crown. If you have tough, hard hard decay, I used to scoop all that stuff out, do buildup. I don't touch anymore. I put the SDF on it. Then when I take off my temporary crown, that cavity, it has a layer, it's hard, it's a layer of silver, and it's wonderful. Now, if you put SDF around the whole prep, take it off, you have to have good retention. It can affect, I've heard it can affect crown, the bonding a little bit. And sometimes I do put it around the whole tooth if I have good retention. If I don't have really good retention, I only put it on the subgingival parts and the decay. And it's amazing with SDF, if you put it on a certain spot and you blow it backwards, it won't, like if it's number 19 and it's subgingival on the mesial, I'll put the SDF, I'll dry off the tooth, I'll put the SDF on the mesial, I'll blow the air backwards, it will not show up in the front. It's just like on the, when I do it in the mouth, if I put on the distal of the canine and blow it backwards, as long as before I move it to the other side, I blow the air and dry it off backwards, it doesn't move to the front. It doesn't go around. One little tip though, I tell my hygienist assistants though, if you do place the fluoride after you put the SDF, is be careful not to take your fluoride brush and go over the SDF thing, because I imagine that you can probably pick up some SDF and move it to another area. So I'm just a little conscientious. I don't, if they're going to do fluoride everywhere after the SDF, I'll tell them put the fluoride on the front teeth first, and then do the fluoride in the back to cover the SDF, so that you don't move it around to the front. SDF gel. Now this is a newer product by Elevate. It's awesome. I just started using it. A lot easier to handle. You apply it just like you do the liquid, but it's a lot easier to handle. Papa Caries, I love this product. Papa Caries, it's crazy, and it's like magic. And some things I don't know how it works, but it's magic. If you have it's wonderful for class 5 decay. Like if you have a big old cavity in 19, you don't have to get the patient numb. Don't really know how it works, but you put it on there, you wait 60 seconds, and you just start scooping up the decay. It doesn't hurt the patient. It's wonderful for kids. It's wonderful for adults. You put it on there, and I've found that when I put it on there, if I don't get it all out, if I can't get it all out, and with scooping it out after 60 seconds, then I just rinse it out and I'll put a little bit more. And it's crazy. It's again, it's magic. And sometimes I tell patients, I'm not a chemist, I don't know how things work. Sometimes I'm like, I don't know, it works. It's awesome. So if you, I would recommend this to any dentist. If you're not using it, you got it. Povi 1. This is povidone. I love povidone iodine. It kills instantly. You don't have to wait around. This application is wonderful because it comes with a little brush. It's a unidose, so you don't have to worry about. You can buy over-the-counter iodine, but this is a lot easier to use. And it reduces, I've heard it reduces cavities like by 40%. I do, and I'm going to throw this in here, and I haven't mentioned this yet, but if somebody comes in with pericoronitis and the gums are irritated, my protocol that I've done for years is I usually will put strong topical on it, let it sit there for a minute, and then I rinse it off. And then I'll blast it out so that if there's any popcorn kernels or anything stuck on the little flap, it's kind of cleaned up. And then I use my little saliva ejector to isolate the area, dry it off. I use iodine. I'll use iodine, and then dry it off, and then I'll put SDF, and I get SDF onto the tooth. I get it on a tissue. It works really, really well for pericoronitis. The silver will attach itself to the gingival tissue. It'll stay there. It'll stay in it for a couple of days, but it just works as a wonderful antibacterial. Anywhere somebody has a gum issue that it's not a cosmetic concern, I'll put the SDF on. It works wonderful. Okay, I talked about the toothpaste. I give for the 148 a year. I give them the toothpaste. What my protocol is, I say, listen, use it once a day at night before you go to bed. Brush with it for 2 minutes, don't rinse it out. And I said, at least wait about 10 minutes before you want a glass of water. So it sits there. but don't rinse it out immediately. That's my way I do it. Now, you might find research says do a little bit different, but it works really well. With a combination of, if you're doing iodine on a patient, if you're doing the Just Right 5000 toothpaste and you're doing the SDF, they're going to get to the point where they're just not having more cavities, and you can do more of the dentistry that you like to do. I won't go over all this, but like I think I did 168 fillings last year, which is not that many in a practice that's really busy. I focus on what I love to do. I love two things. I love getting the patients out of pain. I like controlling their disease. I mentioned the SDF affecting perio. It is wonderful. I had this patient a couple of years ago, and it was this kid, and he came to me and he had just that biofilm plaque calculus over all of his teeth, and he wasn't brushing. And so we cleaned his teeth and we put SDF on all of his back teeth. Came 6 months later, and I could see the little decalcification spots were stained with SDF, which I love. I love that because and the gums look so beautiful when you have a little decalcification that's filled with SDF. The gums next to it look like somebody that brushes and flosses, like awesome. It looks like they have a water pick. And he came, and I'm like, wow, look at mouth, like, man. I said, because the last time I knew, he said he didn't brush and floss his teeth. And I said, oh man, you've been doing a great job. You've been brushing and flossing, haven't you? He goes, and I'm like, what? And he goes, oh, I brushed this last time I was here. It was crazy. There was no plaque and calculus on his teeth. The gums look beautiful. It is amazing, the SDF, when you get SDF on a tooth, how it kills bacteria that produces plaque and calculus, how it makes the gums look so much better. Again, I'm going to reemphasize this. When you talk to patients, it is a game changer. It's the best thing you could do. I do love, if somebody has a rampant decay and everywhere, and we're doing a crown, I do try to do glass ionomer cement. You do that with a combination of having the SDF, especially under the subgingival margins. Is my firm belief, and I have years of experience now, they're never going to get a cavity underneath that crown, especially if you have a layer of SDF and you have a glass ionomer. Not going to happen. As cement, we know cement will wash away over years underneath the crown. With that layer of SDF that is on the margin of mesodistal or anywhere subgingival, where normally you'd start to get a cavity again. When you have that layer of SDF, it's not going to happen. If it does, I've been doing this 20 years. It's not going to happen. You're putting a crown, and if you ever put a crown, and I would do so many crowns, sometimes you put a crown and it looks like cement washed away a little bit, especially if it was a prep, it was really deep. You're like, oh man, I hate that. I hate seeing that like 6 months later, or we take an x-ray afterwards, but maybe a different angle, and 6 months later, like, oh, it looked like the cement washed away at the time we put the crown seated, but I rest assured, I know the person has SDF on the margin of that crown, and I'm like, you're fine. Like in the gums, it's wonderful is when you have that little layer of SDF at the margin of a crown and the cement washes away. The gums are really healthy because it kills bacteria. It's wonderful. I put in here, again, I don't focus on the profits as much. It just happens when you use SDF, but you'll have a lot more profit. You'll have less fatigue because you're not going to be sitting there chasing fillings all the time. And the patients are happier. Patients love it. When you convince them, you tell them that it's going to change their life and they're going to have better oral hygiene, they're going to be able to keep their teeth a lot longer. I don't get no's anymore. I have some insurance stuff on here. So right here, this is the QR code. You can screenshot that, and it'll show you my slides. Again, that was my actual cell number. So if you want to talk to me about SDF, if you want me to possibly talk to your team, get on a Zoom call and talk to your team about SDF. If you have some naysayers, some people that kind of side-eye to you when you start talking about SDF, I can talk to them, no problem. I love, as you can tell, I have a lot of passion for SDF. I love it. But next we'll just have, I guess, question and answers if you have any questions for me.